Standing slings are used to assist patients in weight-bearing, standing, and fall prevention. They are intended to be applied from a seated position and raised to a standing position. The same sling application and transfer procedures are used whether raising with a ceiling or floor lift. As with all medical devices, use sound clinical judgment and always use the lifting device only for its intended purpose. This standing sling is made of quilted mesh. Features of this sling include the body of the sling with the smooth side opposite the label to be placed toward the patient, torso bands and straps with buckles to be used to fit and secure the sling around the patient's torso, leg supports with straps and buckles for safely fitting and securing the patient in the sling, and lift straps at the hip and mid-torso. Within the lift straps are destination loops, used for adjusting the way the sling is connected to the carry bar based on the patient's height and the height of the ceiling. The sling also has a color-coded trim to indicate size and an ergonomically placed handle for grip and control while the patient is being transferred. The sling label lists the type or style of sling, the size, the reference or product identification number, and the maximum allowable weight or safe working load. Remember to always stay within the lowest safe working load of any component in your lift system. The label also includes washing instructions, which are detailed later in this video. Packaged with each sling is a user instruction sheet. Standing slings come in two different fabrics: a disposable single patient use fabric, which uses Velcro to secure the leg supports, and a quilted mesh fabric, which is washable and reusable. Both of these come in multiple sizes. Use the color-coded sling sizing chart to choose the right size sling for your patient. Remember that the patient's weight is just the first consideration when choosing a sling size. People come in many shapes and sizes, and it is completely acceptable to choose a size sling other than that indicated by weight alone, as long as you stay within the safe working load and the patient fits safely, securely, and comfortably in the sling. Visually inspect each sling before use. Discard and replace the sling if any signs of damage or wear and tear are found. All standing slings are applied from a seated position only. Wrap the body of the sling around the patient's torso so that the bottom edge is at the base of the patient's tailbone. Secure the torso bands tightly around the patient's waist with the straps and buckles. Pass the leg supports underneath the legs and up through the patient's inner thigh area, being sure not to have the Velcro make contact with the patient's skin. Wrap the leg supports fully around the patient's leg and secure with the Velcro. Bring the carry bar into position crosswise along the patient. For safety, try to keep one hand on the carry bar at all times when in the transfer area. Connect the loops of the hip and torso straps on both sides. Choose the destination loops according to the patient's height and height of the ceiling. The carry bar will need to be at a height which is above the patient's head once lifted. Whenever attaching loops to a carry bar, make sure to match the hooks and destination loops on the right and left sides so that the patient is raised as straight and as level as possible. Raise the carry bar just enough to put tension on the straps. Make sure the loops are well secured on the carry bar hooks, that the sling is well positioned on and around the patient, and that the patient feels safe and comfortable. If any adjustment is needed, lower the carry bar and adjust as necessary. Have the patient lean forward, placing their nose over their toes, feet flat on the floor, and into a weight-bearing position. Raise the carry bar and have the patient assist in standing as best they can. Be sure to keep their feet flat on the floor and the carry bar above their head. You can see that even if the patient becomes tired, there is no danger of falling or injuring themselves when the sling has been properly applied and used correctly in accordance with the lift. Removing the sling is the reverse of application. To remove, lower the patient to a seated position. Lower the carry bar just enough to put slack on the lift straps and remove the loops from the carry bar. Unfasten the Velcro and buckles from the body of the sling and leg supports. Slide the leg supports under the patient by folding the Velcro into the leg supports, preventing contact with the patient's skin. Remove the leg supports, then remove the sling. Washable fabric slings should be placed in a mesh laundry bag before laundering to avoid tangling, wear, and damage by washing machines and agitators. Wash in a mild laundry detergent and never use any kind of chlorine bleach. Fabric and loops exposed to chlorine will show a color change and should be discarded. To disinfect, wash at 176 degrees Fahrenheit or 80 degrees Celsius. Tumble dry low or hang to air dry away from direct sunlight. Disposable single-client slings must never be machine washed. Disposable fabrics may be wiped clean of light soiling, but should be discarded and replaced when heavily soiled. For more information, please call us at 1-877-304-5438 or visit our website, prismmedical.ca.